Hello, everyone. Welcome to the Blissful Living Podcast. This is the Queen of Feeling Fabulous, Rochel Marie Lawson. And of course, you all know that I am super excited to bring this guest to you because she's going to share some words of wisdom with us about aging and our brain aging. And I think at this point in time in life, we all need a little bit of information about that. So stay tuned. Let me take care of some business. But before I do that, I like to tell you all to find a place to sit, get something to write with, get your favorite beverage, tell the family to give you a few moments so that you can absorb the nuggets of gold that our guest today is going to be sharing with us about brain health and healthy aging with regards to our brain, which is, I think, very important. So while you're doing that, let me take care of some business. I want to thank our sponsors, Blissful Living for You at blissfullivingforyou.com. Check them out. They've got some wonderful things happening in that world. And you definitely want to check out the summits that are coming up, that they're going to be having these live events across the United States, as well as get all the free stuff that they have to help you stay wealthy, well, and wise, so to speak. So check them out at blissfulliving4u.com. The other sponsor I want to thank is All Day Cable Incorporated. All Day Cable is a premier telecommunications installation company located in the heart of Silicon Valley. It is woman-owned, minority-owned, and it is one of the top, I'm going to say 75 businesses in Silicon Valley. So if you have a need for voice data, fiber, wireless systems, whatever it is that you need to do so that you can telecommunicate effectively and efficiently and make that connection right the first time, you definitely want this premier telecommunications company that's been around since 1989. And you can check them out at alldaykableinc.com. So today's guest is Dr. Melissa Green. And by now you guys should have had time to get yourself together, so to speak, so you can take some notes about this nuggets of gold that she's going to share with us. And so I just want to bring her on up and welcome Dr. Melissa Green to the Blissful Living Podcast. How are you, Dr. Melissa Green?
I'm doing well, thank you.
Now, do you prefer me to call you Dr. Melissa or Dr. Green? What's your preference?
You can call me Melissa is fine.
Well, girl, you worked hard to get that doctor.
What either? Yeah.
Girl, work hard to get that doctor. Yeah, so I'm going to call you Dr. Melissa. How about that?
Okay, that's fine. Yeah.
So it is a pleasure to have you as a healthcare professional myself, as a registered nurse for going on my 33rd year this year. I think it's very important. As you know, our health and well-being is the greatest asset that we have. And without that, we cannot enjoy life to the fullest. I don't care how much money you have or how wise you think you are. If you're not healthy and well, it's just, you're not going to be able to live the life of your dreams. And so because on Blissful Living Podcast, we're all about helping the viewers and the listeners to really step in and be able to take nuggets of gold that they can implement in their life immediately to maybe help them with their well-being, their mindset and wisdom, and their wealth. I think this is very, very important. So I want to jump right in, and I want you to tell the listeners a little bit about you and why you decided to specialize in brain health and the aging brain.
Okay. So I am a clinical psychologist. I've been licensed to practice for a long time, since 2008. So I'm licensed to practice in the state of Georgia and Hawaii. And this is actually, you said this is your 33rd year. This is my 25th year in the field, in the mental health field for a while. I started as a school psychologist doing testing in K-12 educational settings for special education eligibility. Then I shifted to work with the military, doing a lot of combat trauma therapy. Then I worked in forensics for about 3 or 4 years, doing competency to stand trial evaluations and expert testimony. And more recently, I have started focusing my work on brain health, healthy aging. How I came to that actually is through my personal experiences. Back in 2014, my dad was diagnosed with Alzheimer's and vascular dementia, so two types of neurocognitive disorders, and it was devastating. I'm a daddy's girl. I'm very close to my dad, and at the time I was living in Hawaii, like living a wonderful life. And my whole world came crashing down, right? Because everything changed. It changed the trajectory of my life. I picked up and moved back home to Georgia. And I knew at some point I wanted to help caregivers of family members with dementia, and also help people who through the aging process, to learn more about what they could do to combat cognitive decline. So that's kind of how I got here in this space.
So, I mean, sorry to hear about your dad. I actually have an aunt that is a in the midst of dementia, so to speak. And, that was not my specialty when I was in clinical practice. My background is emergency room trauma and flight nursing. So, to have my beloved aunt going through this and watching this, the last time I had an experience with anybody with dementia or Alzheimer was when I was in nursing school. And so, if you can just take a moment to share with the listeners, because I think a lot of times people don't know the difference between dementia and Alzheimer. And it is a little bit of a variation between the two, even though they may appear to be the same. It's a little bit of a variation. Can you just share with the listeners so we can educate them about the difference between the two?
Yeah, so dementia is really an umbrella term for a lot of neurocognitive disorders, meaning that it affects the brain, basically. And Alzheimer's is the most common type of dementia. So a person who has been diagnosed with Alzheimer's has dementia, but a person who you may hear say has dementia may not have Alzheimer's. They may have a different type of dementia, but Alzheimer's is the one that is diagnosed more frequently.
And with regards to, the cognitive, I want to say, limitations that come upon those individuals that are diagnosed with dementia or
Mm.
Alzheimer, what are some of the prevalent things, or what are some of the most prevalent things that you see as a doctor, clinical psychologist, when it comes to people first presenting with those little signs and symptoms that sometimes we kind of blow off, but are really, really key components of us recognizing that there may be a problem in that area?
So the first thing that people, excuse me, typically think about is memory, and that is one of the key factors. However, we all have slips of memory at times. So just because there is a problem with remembering things doesn't automatically mean that there's dementia. But if you have difficulty remembering things, and then you can't, just say you misplace your keys and you can't track back to figure out where they were or narrow down the possibilities of where they could be, that's different from a person who may have dementia or the beginning stages where they may not be capable. Likely they are not, depending on what stage they're in, they may not be capable of backtracking. So that part of problem solving and cognitive functioning is no longer there.
Got you. I think as we all begin to age, we all have those memory lapses, so to speak. Like, dang, where did I put that? And some people start to freak out, particularly when they get in their fifth decade of life, because we've heard so much now in mainstream media about Alzheimer's, and everybody thinks like, well, because they start forgetting stuff, they're getting dementia or Alzheimer's, but it is a natural progression for us. Can you share with the listeners what are some of the real key differentiations between just normal aging, memory loss versus the real cognitive dementia type of memory losses that occur.
So, in order for a person to be diagnosed with a type of dementia, it has to not only be problem in memory, but also one other area at least, like problem solving or um, having difficulty doing familiar tasks, things that they were able to do easily before, or that a person may be confused as far as time and place, disoriented, so to speak. They might even have difficulty, and this happens a lot with direction. So visual spatial difficulties, not knowing how to navigate from one place to another, even if it were a place that they had traveled to and from many times. There can be problems with language, expressive language, and also receptive language. So you may hear people saying words that aren't really words, so they're not really communicating effectively, or they may have difficulty understanding what is being said to them. So those are some of the things that maybe will differentiate between a person who's just maybe having a memory lapse or having a moment of being confused versus someone who has more significant cognitive decline that is consistent with dementia.
Right. I know there are key factors when it comes to just, normal aging with regards to our brain health, and then, the diagnosis of dementia or Alzheimer. I know one of the things that I remember from nursing school is that the more progressive the dementia becomes, the people move from, out here to in, so to speak. So for instance, they can remember all those people that were close to them in their past. Like my aunt, for instance, she can remember all of us, but she can't necessarily remember, and she can remember like what we did when we were growing up and all that kind of stuff, but she can't remember the simple task of remember to take a bath or shower each day, or remembering how to turn on the television, or some other things like that. Also, what we've noticed with her is that, and I've seen this with other patients or other people diagnosed with dementia or Alzheimer, is they tend to become very angry. And can you share a little bit more wisdom about maybe why that happens, and what we can do to support them so that we can cool some of those fires of anger within them and help them to understand it's okay and be understanding ourselves, because sometimes people like us that don't have that, we're not as understanding as to why they are this way. Can you share some words of wisdom behind that?
So you're absolutely right. There are a lot of personality changes and mood changes, and obviously we don't know exactly what's going on, but the thinking is that just imagine being in a place where everything is unfamiliar. You see people that you don't recognize. Maybe you're in a place that's not familiar, even though you've been there for years, it may be unfamiliar. So that creates anxiety for a lot of us if we're in an unfamiliar place, a new situation, where things are not predictable, right? That's what contains our anxiety, when we have routines and things that are predictable, things that we know. So when there are those changes in the brain, a person with dementia may not recognize people that are familiar to them or that have been familiar to them in the past. And that could be scary, because oftentimes those people, like, with my dad, I'm telling him what to do sometimes, or there are other people who are around him that are caring for him that, he doesn't know. They're instructing him to do certain things, and he doesn't know if it's safe or if it's not safe, because he doesn't know these people. So it's a scary. It could, I imagine, obviously I don't know. Nobody has told me this. Nobody with dementia, but the thinking in the field is that it could be perceived as something very scary and something new to someone with dementia. And also, I know I've seen this with my dad at times, especially he's a little further on now. He's actually 90, but he's doing well for a 90-year-old. But when he first was diagnosed, there would be times when I knew that he should know, but he knew he didn't know. And so that was frustrating for him. So, just it's humiliating probably and embarrassing to think, oh, I should know this person or I should know how to do this, but I don't. And like for instance, sometimes there would be family members, and we stopped doing this a while ago, saying, hey, do you know who that is, or do you know who this is? And I could tell if he recognizes someone by his facial expression, because sometimes he'll just have a blank face, and
Mhm.
sometimes he may not remember the person's name, but he feels comfortable, he laughs. And so I started using that as a gauge, because I could tell he would say something like, well, who is that? You know who that is. He didn't want to admit that he didn't know. The other thing that can contribute to mood changes is that usually a person with dementia, because it's a progressive disorder, well, they are the different types of dementia, um, that person is usually losing some of their autonomy, if not all of their autonomy. And none of us want to do that, right? People are probably telling them they can't drive, they can't even bathe on their own. They might, that's intrusive. They're trying to preserve some of their autonomy and independence and dignity, honestly. And when it's, we're kind of forcing them because we feel like, we know we're not asking them to do something that's not safe or that's not good for them. It violates that space where they feel like they can't, speak on their own or advocate for themselves.
Yeah, it's amazing. My aunt used to cook all the time, and so she still thinks she feels like she could do that, but it's not safe for her because she forgets to turn things off. So, okay, I want to shift a little bit,
Okay.
and so now that we know a little bit more about dementia, and Alzheimer's, so to speak, and some of the things that we will come across. If we have a family member or a loved one that might be getting to begin to exhibit these things, now that we know a little bit more about that, let's talk about, are there things that we can do? Now, I'm not really sure, and I'm pretty sure that there's, if you're meant to have dementia, it's just going to happen progressively. But are there things that we can do to help our brain to age healthily, or very healthily, so to speak, that can circumvent some of these things that happen as we age? Our brain ages, that might lead or be a precursor to dementia or Alzheimer.
Well, that's the good news. Yes, there are. And um, there are things that we can do. And I obviously won't talk about everything that I know, but I know the AARP and the Global Council on Brain Health partnered together to do research on things that can be helpful. And they have published a report on 6 things that can be done, and I can talk about a couple of them. Actually, before I talk about those, I want to talk about our age beliefs and how that can impact. So this is not something that's directly included in their research. It talks about emotional and mental well-being and making sure that you manage stress and those kinds of things. But also, there is some research out there that indicates that your belief about aging, so whether or not you feel like it's a negative thing versus a positive thing, actually can impact the way that you age, and it can have a significant impact up to like 7.5 years.
Wow.
It can increase longevity if you have a positive belief about aging. And it's important to, I think, bring that to people's attention, because that's the one thing that we really have a lot of control over, even though we may feel like we don't, because we're bombarded by so much information that says when you get a certain age that you're old. I turned 50 in 2021. And so I always say I have to proudly announce that I'm 51 now, because now I know, well, I've always done that, but I know that there are benefits to doing so. Thinking about the aging process, not in a way that you think that, oh, my life is over, or I'm going to have all of these problems, or not attributing every issue, every ache and pain to aging, can help to combat that. Also, that survey or study that was done by the Global Council on Brain Health, they also obviously talk about the things that you eat. They talk about the mind diet, which as a nurse you may be familiar with. I recently just learned about the mind diet. I know there's the DASH diet for people with hypertension, and the Mediterranean diet. And the mind diet is actually a combination of those. And other things is just being mobile. And you don't have to do a marathon, but just staying active, getting up and having movement breaks throughout the day can have a significant impact on obviously your physical health, but your mental health or emotional well-being as well, and your brain health. Yeah.
I love it. I love this
I feel like
information.
I'm gonna take a break.
I love it. I
I'm
love it.
talking
You know, it's so funny because I'm way older than you, but I always tell people I'm 29, and I guess some people, but in my mind, I feel like I'm 29, and it's like I don't care if I could be 175. I think I'm still gonna always feel like I'm 29. I'm active. I'm vibrant. I eat healthy. All of that. But that's just me in my mindset. And so, what you just shared is key. Key. Just eating right, having, loving thoughts about your aging and being grateful that you've gotten to this place, because so many people don't get to the ages that we are in our fifth decade, so to speak. And so I really think that this is important information that's really not out there, but is really simplistic. And also, there was one thing I remember when I was taking care of a patient that was 94 years old, and she was sharp as a tack. And I asked her what was her key to longevity, and she told me, always surround yourself with young people, because they keep you in the know of things, they keep you active, and they keep your mind ready, ready. So I know we're pretty close to our time, because I know you've got some other commitments, but I'm so thankful that we were able to have this discussion about Alzheimer's, dementia, and the aging brain, and things that we can do to help circumvent some of that, because I think it's very, very important. And as we continue on our trajectory of life, so to speak, why not get as much information as we can that's going to help us to stay healthy and young, not just in our bodies, but in our brains, our mind, our soul, our spirits as well. So is there anything else you want to share, Dr. Melissa, before I let you go, because I know you're a busy lady?
Well, I think the point that you just made, that the information that you had gotten from an older person is key as well. And there is research to support that. Socialization and multi-generational relationships does feed the brain. It does help on both ends. It helps one to feel like they're able to still contribute to society, the older adults, by teaching the younger adults or the children as well. And it helps the children to feel connected and learn more about their roots.
I love it. I love it. Well, there you have it, you all. It was quick and short and dirty, or clean, so to speak. But some wonderful information that can help all of us if we just incorporate a little bit of this information in our lives. Who knows? By the time I really do I always say I'm gonna die when I'm 110. Heck, the way things are progressing in the medical community, 110 might be the new 50 when I get there.
Right. Yes. Right.
It's good information. But I want to thank you so much for your time, Dr. Melissa. And to all of you that are
Thank you
currently
for having me.
watching. Oh, I appreciate it. Share this show with everybody you love and care about, because the information that is shared on the Blissful Living podcast is really designed to help you to live a better life when it comes to wellness, wisdom, and wealth. I want to thank our sponsors, Blissful Living for You at blissfullivingforyou.com. And I want to thank All Day Cable Incorporated at alldaycableinc.com. Without their partnership, this show would not have been possible for the last 12 years. So thanks to our sponsors, thanks to you listeners and viewers. Please, again, share the show, subscribe to the show if you like it, subscribe to the show and get the juice, because you'll get the information of the guest prior to having just to show up and watch the show. Okay, so as always, my beautiful listeners and viewers, I am the Queen of Feeling Fabulous, Rochel Marie Lawson. I have been having a wonderful conversation with Dr. Melissa Green. And as I close out the show, I want to wish you peace to your mind, wellness to your body, and tranquility to your spirit. And until next time, take good care, my friends. Go out and tell somebody you love them and give them a big hug. And I'll see you next time. Have a beautiful day, everyone. And goodbye for now.
Goodbye.